that would be greatly appreciated. Also, those of you that clicked away from the Avalanche Parade, let's go Avs. Huge Stanley Cup victory and a celebration going on downtown. So congratulations to them and all of their accomplishments. But one of the issues that came up in our first Facebook Live was we posed questions to the community, and one of them came up about mental health and what we're doing to address mental health calls. And today I'm joined by our behavioral health program manager, Julie Jacobs, to talk about what we're doing with our co-responder model. The co-responder model here at the Arapahoe County Sheriff's Office is new, and we've added it into our level of service that we provide the community. And I think we run it in a unique way where we don't have mental health clinicians responding in the cop car with deputies, but they actually have their own vehicles and respond to different calls when requested by deputies, but also respond to calls for service that they hear come over dispatch. And so it's important to know what we do and how we do it. This program, like I said, started a couple years ago and is, I try to give credit where credit is due, and Chief Glenn Thompson, our Public Safety Bureau Chief, was instrumental in getting this started with the City of Centennial and partnership with the Board of County Commissioners. So I'd like to thank both of those entities for being forward-thinking and progressive and listening to the subject matter experts when it came to needs of our community. And mental health is one of those. We're seeing a rise in mental health calls that is second to none other call that we're receiving, and people need this assistance, and I think it's something that we do very well. And I'm going to hand it over to Julie and have her kind of discuss the program a little bit more in depth, and then we'll answer some questions and then open it up to online questions to make sure that we're meeting everybody's needs. And remember to feel free to reach out to the Sheriff's Office at any time if you have specific questions. We will be having a third Facebook Live. I think these actually are great for the community, and we'll talk about other issues that you guys have concerns with. I know one of the ones that we specifically were talking about is the opioid crisis and what we're doing to address that. And I think that falls directly into the conversation that we're having now when it comes to mental health and people self-medicating and trying to deal with their crisis on their own. And that's where we need professionals. So Julie, please welcome, and thanks for joining me.
Absolutely.
Yeah,
Thank you for giving us the opportunity to be here. Really happy that people are showing a lot of interest in the program and what we're doing. I'll just kind of give you a little bit of background. The co-responder program has been with the Sheriff's Office for 2.5 years now. We went internally with our own employees about a year ago, and that has been great success. Currently, I'm managing 5 co-responders. They're all licensed within the state of Colorado, which is very important for us, for them to be able to get out there with their education, their experience, write those M1s, assist the deputies, and allow the deputies to get back to work doing what they need to be doing, which is serving the community and keeping you guys safe. Some of the differences with our program that you will not see in some of the, when you compare to other co-responder programs, is our co-responders respond independently of deputies. Several reasons why we do that. You know, we have our own fleet of vehicles, and with the size of the county, the amount of calls that we get, having them respond in their own vehicles allows them to respond quickly, cut down response time. They can transport individuals to hospitals and designated treatment facilities, again, allowing deputies to do actual police work. They're writing the M1s for the deputies if they can. We are avoiding extra costs by not having individuals having to hop in an ambulance for those transport, which is a nice service that we're able to do for the community and those members that are in crisis. Last thing we want to do is, you know, give them another bill that they have to pay. So if we can help with that, all of our clinicians, again, like I said, they're all licensed with the state of Colorado. We have them from many different backgrounds: substance abuse. We have ones with experience in residential treatment, private counseling, so a wide variety of services that we can provide and expertise.
That's amazing.
Yeah.
And I think one of the things that we highlight too is that we have 2 different training models for our deputies. One is that every deputy is going through mental health first aid, And so this is an 8-hour course which allows deputies to have just some baseline knowledge and information of identifying mental health crisis and how they can identify that quickly and then be able to contact our mental health units and have them respond on scene and either take over control or work in conjunction with the deputy. The second part of that training is crisis intervention training, and that is another level. I like to call those deputies our mental health SWAT team, and those are the deputies that are really engaged in addressing mental health crisis, creating relationships and creating a rapport with individuals, and then handing that over to that master level certified clinician that has that a little bit more expertise to come in and assist those individuals. And I think you nailed it on the head when you talk about cost savings. You know, you're looking at ambulance transports that could be anywhere from $900 to $1,500 for a person who's going through crisis, and that's just one extra thing that we don't need to add.
Right.
Yeah, and I personally had experience dispatching one of our mental health units out to a neighbor, and it was a great success. And I share this story with people all the time. And the individual was an 18-year-old kid going through some hard times in his life, using some substances, and the mental health co-responder responded in plain clothes, no tactical gear on them at all. We provide them safety equipment if they feel like they need to wear it in certain situations, but normal day-to-day civilian clothes. And they sat down and they made a connection with this gentleman, and that connection led to long-term residential treatment and now months of sobriety. So it was a very quick connection to getting somebody on scene, addressing those mental health needs, getting them the resource here locally, and then getting them an outside residential treatment program. And I'm proud to say that young man is very successful now and is gainfully employed in the community and doing very well. And so, we hear a lot, and you said allowing deputies to return to law enforcement work. And we've heard a lot of it lately. Do we really need social workers responding to calls for service? And I think that is a gross oversimplification of what we're actually doing. Mm-hmm. And what we're really trying to do is address people at their level of need at the time. And it's not always the criminal justice system. We'll be the first to say that. And I think if we talked about the numbers, and you probably have them a little bit more readily accessible off the top of your head, but over the last year, responding to more than 3,000 calls for service is what it was, and being able to divert, probably a third or more of those from the criminal justice system, that only isn't benefiting individuals that are going through the crisis to get them better. It's benefiting the law enforcement officers that are able to go out and really dedicate their time and service to addressing crime, where these mental health issues usually aren't a criminal activity. Mm-hmm. There's somebody that's just going through a hard time. And you mentioned M1 holds, and I think if you could explain kind of a little bit in depth what a mental health hold is here in Colorado, I think the people that are watching will get a better understanding of what an M1 hold is and be able to share that with the community. And I think that's something that we like with these Facebook Lives, is that we're getting the information out there. It apparently lives on the interwebs forever, but you can share this information with your neighbors. You kind of that 6 degrees of separation from Kevin Bacon. If you tell your friend, they'll tell another friend, and so on. And that really spreads the message of what we're trying to accomplish here at the Arapahoe County Sheriff's Office, and kind of being one of the leaders in this area when it comes to providing mental health services through a law enforcement agency. So if you could explain kind of what an M1 hold is, and maybe go into a little bit more in depth about those numbers of calls that we responded to using the mental health co-responder.
The mental health holds, it's written under Colorado statute 2765, and it gives specific requirements and rules of who can write an M1 and what criteria has to be met in order to take an individual, because you're literally taking their rights away. So in order to write an M1, they have to be an imminent threat to themselves, to others, or be gravely disabled. And when it's a clear-cut M1, everybody on scene is happy. It's, sometimes we get on those calls where they don't meet that criteria, and those are the difficult ones. But, because you have the family members, you have the neighbors who believe that this person needs to be taken to the hospital. but we're given that platform and the opportunity, to explain to the community why we can't do that M1. It's not that we don't want to, it's not that we don't agree that this person needs help, but with the clinicians and the time that they have available to them, the resources that they have, which deputies may not, they can spend that time on the calls and on scenes, discussing with family, friends, neighbors, other ways to handle those avenues, when that individual is experiencing a mental health crisis, because we can't just take somebody away. And we don't want to either. If we can avoid, unnecessarily filling up the emergency rooms and, or taking them to jail because of a mental health crisis, that's what we want to do. We want to provide the most appropriate level of care, appropriate level of treatment at the time. Last year, we wrote, let's see, we wrote approximately, we did 5% of our calls, 11% of our calls resulted in an M1, which as the longer the program is going, we're able to find, again, those different avenues. So can we maybe talk to the individual, and if they don't meet criteria for, for an involuntary hold, can we take them, will they go voluntarily to a walk-in center? Will they allow, mom and dad or family members to take, to take them, to transport them? Are they willing to engage in any type of treatment? So those are kind of really a lot of the things that, we're trying to do if we can't get that M1. And then again, on the flip side, again, to educate family why we can't do it. And again, it's hard. It's hard for us to walk away sometimes.
It is, yeah.
But if we can give them any tools, to help with those situations, if we could work with family, if we could work with friends to try to get them in service. And sometimes it takes us a couple calls, to get them and to work with them, and that's okay.
And I think that's the great opportunity that these mental health co-responders have, is they have the availability to go and do follow-up the next day. They might not always have a mental health call going on, and so it allows them a little bit more freedom to go and follow up with the individuals that they made contact with on a previous day. Where a deputy who is responding to 911 calls and calls for service through our dispatch center might not have that time to go and do that follow-up. And these mental health professionals that we have are absolutely amazing, and they're dedicated and they're integrated with our team, but their focus is making sure that individuals are getting access to the resources that they need. And what are some of those local walk-in clinics that we're able to transport people to outside of the hospital, where we're not clogging up emergency room beds, or again, another exorbitant cost for individuals is going to the emergency room.
Right.
And some of these community centers have options or even have grant programs that help assist in that treatment. And so what are a couple of those?
Right, we occasionally use the one with All Health down on Santa Fe. We use Highlands Behavioral. We use the Aurora Mental Health Center, and then there's, what is the other one, Caleb? Denver Springs is one that, we work with really well. And, we're trying, as this program develops, we're trying to build relationships with those providers as well to figure out, what information do you need from us? What is the best way to get this person past, the door and get them to stay? So if that means the co-responder walking in, meeting with the doctors, meeting with the nurses, and explaining all that information and taking that extra time, if it's gonna help that person get treatment and services, it's something that we're gonna do.
And it's well worth it. I mean, you look at, if we're able to keep somebody out of the criminal justice system, even if they're brought to the county jail just for the night, that costs people approximately $128 a day. There's some change that gets added on there depending on what we have going and what our population is. But if we're able to treat people in the community and reduce their chance of having to use 911 again and give them the tools to succeed, we're not only benefiting them and our communities, but we're benefiting technically the bottom line and really trying to be good stewards of the taxpayers' dollars when it comes to housing people in our detention facility. And we all can agree, from top to bottom, left to right, wherever you stand, detention facilities are not the place to conduct mental health treatment. If that individual needs to be held accountable for criminal activity, yes, we're going to do that. But if we can avoid that, that is our goal here, and making sure that they get community resources. I will say that, you know, being able to have 5 clinicians right now is excellent. We are in the process right now of expanding that. I know that we took a budget package recently to the city of Centennial, which they approved for another mental health clinicianer, and we will be taking one in September to the Board of County Commissioners to expand that by 2. I personally think it would be great if we had, you know, a dozen, but we're growing,
Right.
and we're doing it slowly and responsibly, making sure that, you know, we're not just filling up those spots and not having a use for them. But we talked about them having their own vehicles too. You wouldn't recognize these cars driving down the street. They're an everyday sedan. The only thing that they have that's similar to a law enforcement vehicle is a computer and a partition, so we're able to safely transport people that are in a mental health crisis, whether it be to an emergency room or one of those walk-in centers that Julie talked about. So I know that there's a lot of questions out there. We've been talking now for, I think, almost 20 minutes straight, so we're good at that. We love sharing what we're doing here at the Sheriff's Office, but we'll open it up for a couple questions, and we're joined by one of our clinicianers too, off camera. We won't drag him in on his day off to be on camera, but I know he'll answer a couple questions for us, and we'll see if we can get to a lot of these that are coming in online or questions that we've received previously. So
we do have questions and comments coming in, and one person's asking, how do you handle calls about the homeless, especially if they involve mental health?
That's a great question, and I think that it comes down to resources, and I mean, correct me if I'm wrong, but dealing with people that are experiencing homelessness is a very delicate situation. There's inside of those homeless encampments, there's sometimes people that are dealing with mental health crisis. There's sometimes people dealing with substance use disorders, and you know, we take those calls very seriously in terms of safety, but we also want to make sure that we provide them with resources. And
Right.
if there's anything that you'd like to add, Julie, about that.
Sure. You know, obviously, I don't think it's a secret that, you know, Arapahoe County doesn't have shelters. You know, and there's a great committee working on how to handle the homeless population here in Arapahoe County, and making some progress with that. But, you know, when the co-responders do get called out to somebody who is experiencing homelessness, you know, we will work with them to try to find them resources, connect them with any resources that they may have here in Arapahoe County. If we can try to get them to a shelter, we're going to try that. We've been very lucky where we've had a couple of nonprofits donate hygiene bags to us as well. So we have the ability to go out and, you know, give, you know, some folks winter gear, food, water, occasionally some bus tokens to get them to where they need to go, and try to get them off the street, and try to get them some of the services that they really need.
And it's truly about compassion and making sure that we're just meeting people at that human level.
Okay, someone else had sent a question in earlier about our 911 dispatchers, and are they properly trained to handle mental health calls, and if so, how?
Yeah, another great question. And the earlier on, I mentioned that we have 2 training programs, mental health first aid, which is an 8-hour course, and then CIT, crisis intervention training, which is a 40-hour course, and that's a little bit more in-depth. And each one of our dispatchers goes through that more in-depth training class, the CIT trained individual. So they're able to answer calls, identify what people's needs are at a very high level, and then pass that information on to deputies to get them on scene, as well as mental health co-responders. I've heard several times where dispatchers have gotten on the radio, said they believe that this is probably more of a mental health call, and I've actually heard co-responders get on and say, I'm good going there by myself, and they respond, and it allows that deputy to stay free and handle more criminal activity, but they are all trained in CIT.
Okay, I thought this was a good question too. Are the deputies who go on these mental health calls properly trained in de-escalation, and how do they identify which calls require a co-responder?
I think that goes back, they are trained in de-escalation, but again, everybody in the agency is at minimum trained in that mental health first aid that gives them baseline knowledge of identifying mental health issues. And then again, we tap into those individuals who are engaged in that process and want to expand their knowledge base and their training, and we turn those into our mental health experts inside the deputy realm. And they work very closely with our behavioral health co-responders.
Okay, and someone else asked, what about sending a plainclothed officer? Would that be better suited to avoid escalation in these events?
I think it depends in every situation, but you have to remember that our deputies need to be prepared for rapidly evolving situations. It might not be the situation that they're specifically dealing with the person that's in mental health crisis, but there could be something else that they need to respond to quickly. And so we respond to the individual with mental health crisis. We identify that that's what they're going through. We hand them off to a behavioral health co-responder, and then that deputy is able to respond to something else in the community. So it's important that our deputies stay well equipped, but also have that training to make sure that we're handing those calls off in the right direction.
And you know, when a co-responder does show up on scene, that's one of the reasons why we like to have deputies show up, is because there is a lot of unknown. So the deputies are going to show up, make sure the scene is safe, you know, make sure it's secure before that co-responder even enters the residence. And as soon as, you know, the co-responder gets the all clear, they become primary on the call, and the deputy is really there just for backup in case something happens. So our deputies are very good about allowing the co-responder to take the lead and navigate that call to the end. You know, and at sometimes, you know, we have deputies will leave in the middle of the call as well.
This question came in from someone who it looks like might want to be a co-responder.
Okay.
She said, I'm currently in graduate school pursuing my master's degree in mental health counseling. My question for Sheriff Brown is, how would I go about getting a job as a co-responder? What tips do you have for potential applicants? And what should I do to bolster my experience before applying? Thank you for all you do.
That question was asked directly to me, but I'm going to hand that over to Julie, and then I will say that we are always open for experiences. Obviously, having concern with HIPAA issues and doing a ride along with a mental health co-responder. I don't know what that looks like, but we can obviously explore those possibilities. So.
Yeah, we're always open if somebody wants to talk to one of the clinicians and ask about experience. But you know, what we've realized during our hiring process in the 2.5 years is crisis work, crisis experience. So if that's what you can start doing now while you're still in school, start getting like some internships or work experience in that field, that's what's going to help you out. Because this is not your typical, you know, office setting. It's not it's not therapy that they're doing. You know, the clinicians see a lot of violence, they see, unfortunately, you know, injuries, they see, you know, suicides, and, you know, it's not always pretty. So we don't want somebody to come in and obviously create any, you know, trauma to somebody coming in. They have to be willing and understand that this field does get, it gets pretty deep, you know, with what they're going to see. But, you know, if you can get that crisis work, that's going to be one of the main tickets in for this position here at the Sheriff's Office.
And not to put you on the spot,
Yeah.
but would you entertain having interns that are in that master level program?
You know, I think at some point, you know, our program, you know, we just became fully staffed 6 months ago. It does get a little difficult with the supervision, but you know, who knows what's going to happen in the future? You know, as we start getting more resources available to us, you know.
So don't hesitate.
Never say no.
Never
right?
say no. Yeah.
Yeah.
So, and don't hesitate to reach out and ask questions. Like Julie said, she's available, and our clinicians are available to talk to, and just kind of get a little bit more in depth from what their experiences are.
Someone is asking on the live, who does someone contact for the lack of mental health services in the state? She said your ideas and what you all do is great, but it kind of ends there at times. So it sounds like maybe she just wants to know in a broader sense who she can contact if she needs help.
I mean, if you need help, please call us. But I think the way you're asking the question is, where else do we get funding from, and what are the other revenue streams, and how else can we expand this? And that's something that we talk about regularly down at the state capitol. And I think that that's where a lot of conversations need to happen, whether it's with your local state senator or your state house representative, hearing from their constituents that they would like some focus on this. And I know that the governor's office just last year dedicated some money towards mental health and co-responder models, and those grant programs are available, and we actively participate in those grant programs. So did we get awarded any grant money?
Not for the co-responder.
Not for the co-responder program.
Nope.
But there are models out there, and as those grants become available and as that money's made available, know that we're tapping into that as well. We try to work hand in hand with our state legislature. But again, I think setting the example and setting the model of what it should be makes things a little bit easier. I think people are always a little bit tentative to put money into something that they're unsure of, and I think that we have the data over the last couple of years, and those data points are only going to expand as we get deeper into our program, and now that we're fully staffed, and we're going to be able to add a couple more clinicians here over the next year, what it really does and the benefit that it has for the community and the benefit that it has for the criminal justice system and diverting people from that. So reach out to your local legislators, and we can continue to have those conversations. But I'm always open for those conversations as well. You can send me an email, tbrown2@arapahogov.com, or reach out at any one of our website links, and that'll bring you back to the sheriff's office, and we'll be able to talk about that, and any support that we can get would be greatly appreciated. So.
Okay, and what happens if a co-responder gets injured on a call?
Well, fortunately, we haven't had that happen. But obviously in this field, risk is inherent. But again, this is why we do have deputies initially showing up on those calls. And if a deputy does not feel comfortable leaving a co-responder on a call alone, or if the co-responder doesn't feel comfortable being left alone or even transporting a client, we go the safe route. All of our clinicians, when they are hired, and part of their training program is they go through safety training, they go through personal safety, they go through scene safety. So we try to give them any tools that would help them basically defend themselves and get away. I mean, they're not police officers. They're not going to be trained to, do the restraints and do the holds. It's more so for their safety. But they're sheriff's office employees. So I know there was a question as well about their mental health and how that's treated, because, again, they see some traumatic, events and stuff. But, like all the other county employees, they have the access to the EAP. Our clinicians do supervision. They can do individual, and we do group supervision. So we're always, watching for their well-being, making sure that they're taking care of themselves. Self-care is a very important thing, but, also the safety. So if we can give them whatever tools that are appropriate for a civilian to have in the streets, we're gonna do that. And it's ongoing training.
And I think one of the things too, when you're talking about a physical injury, it's important to know that they do receive that training, but the deputies are there to support them in any way possible, and to make sure that everybody stays safe. And that's ultimately our goal as law enforcement officers and employees of the sheriff's office, is that everybody goes home safely with what they needed. And sometimes that is mental health for our personnel. And we do debriefs on large calls that involve a lot of different moving parts and involve tragedy sometimes. And then we also, above and beyond the employee EAP, we have our own psychologists that we work with, and we pay for that here at the sheriff's office. So we have funding built in. We don't know who goes and receives that treatment. We just get the bill at the end of the month, and we're making sure that all of the mental health needs of all of our employees is taken care of.
Okay, we have a question that came in just now, and Stacy asks, when a police officer arrives on a call, do they have a brochure with mental health resources to provide those people for follow-up?
There are brochures that they can provide. We are working right now to revamp those, so we should have some new brochures out within the next month or two. In the event that I'm assuming a co-responder is not with the deputy. But we have a system set in place where if a deputy responds to a mental health call in crisis and a co-responder is unavailable for whatever reason, the deputies fill out a referral and they send them to our staff after that each call, and then we have a co-responder reach out to that individual or to that family, typically the next day, to follow up on the call, make sure that the deputies were able to give them some resources, fill in any gaps that the deputy wasn't able to provide, and sort of guide them a little bit more than what the deputy may have been able to do. And we'll follow up to as after they've been released from a hospital. So we try to keep that circle going and that communication going and make it open with the deputies and the community, even when we're not available.
Okay, and then someone else asked, what do the deputies do if there's no co-responders available?
So I think that that's where our training kicks in, and that mental health first aid, and then the CIT team, our crisis intervention trained deputies, get involved, and that's when they really use that knowledge base. And if they have the opportunity to, they work in conjunction with, and they know from previous calls where they might be able to take somebody, whether it be to an emergency room or one of those walk-in centers, to get them those resources. But that information is shared regularly, and that communication that we have with our team. And that's really what this is. Our co-responder model is a team model. It's not an outside entity and us trying to work to make something work. We've made this work inside of our agency to better serve our community. So that information gets shared regularly, and we have the deputies out there that have that baseline training to get people to those resources above and beyond, and whether that be a walk-in center or an emergency room.
Okay. Someone on Nextdoor asked, where is the money coming from to pay for all the co-responders that you're hiring?
So, no, this is where the partnership between the City of Centennial, us being the law enforcement provider for this city, as well as our funding comes from the Board of County Commissioners. So we receive money through our contract to provide services to the City of Centennial, and annually our funding comes from the Board of County Commissioners. So when we go out and ask for new FTEs, this money is given to us through the general fund budgeting process, and that's where it's coming from. And I think as we expand and some of these monies become available through grant programs, we'll be able to tap into that and hopefully make sure that we either use that appropriately inside of our existing program or be able to expand our program. So it comes through the normal government budgeting process. We could have an entire Facebook Live on financing for local governments. We're not going to do that ever, but we could. So.
Okay. Another good question. How do deputies handle someone with a handicap or a disease like Alzheimer's, or someone who's just not a good communicator? Many situations don't necessarily need to end in arrest and may just need a little more compassion.
And I think that that's exactly what we're striving for right now. And, to end an arrest, we have to have probable cause of some criminal activity. But that comes in all of our training. So the state of Colorado requires peace officers to attend at minimum 24 hours of continuing ed per year. Our deputies attend anywhere from 100 to 120 hours of continuing ed. And part of that is how we communicate with individuals with disability, how we adapt to different communication styles, and ways that we can interact with our community better. And I think that that's also part of the co-responder model. If we're having a hard time connecting and we can bring somebody else in from the team to make an impact in somebody's life, that's exactly what we're going to try to do, because we believe in the same way you do, not every law enforcement contact ends in arrest, and we don't think it should. And our deputies are really about community service, and that's where this co-responder model comes in. Is this is truly a community service. You hear a lot of people say, we need to make people better so when they return to their community. This is all of our community, and that's our goal, is to make sure that people are coming back into our communities better, whether that's through mental health resources or any other type of avenue that we can provide. And going back to the homeless camp issue, it might not even be a mental health issue or a substance abuse issue. It might be a job training issue. And you would be amazed at how engaged our deputies are in trying to make sure that they can help people get to those resources and continue a fruitful life. And that's truly what we're trying to accomplish here.
Yeah, and all of our co-responders, they have all that additional training, with working with, people on the autism spectrum disorder, or, if they're IDD, they can go to these calls and they're going to be the first ones that attach and want to go to those calls and help the deputies navigate those. It's also part of our trainings that we're starting to put on for the deputies, is telling them how to talk to somebody that may be experiencing, be on the spectrum or have developmental disabilities, how to talk to them, how to approach them, what to do, what not to do. Because again, we don't want to go in there with this authoritative figure and scare somebody. We want to be able to communicate appropriately with our clients and with the individuals.
Exactly.
Okay, another question that was asked previous to today is, how bad is the mental health problem in Arapahoe County? And what's the percentage of calls that require a co-responder?
That's a tough question to answer. And I've tried to drill down, but when calls for service come in through dispatch, our dispatchers will typically code a call based off of the initial information that they're receiving. So it's a verbal dispute, it's harassment, it's a theft, it's whatever. But once a deputy gets on scene, or as the call taker starts getting more information, we start seeing that there's a mental health component. So they're not necessarily aired out as a mental health call. And well over, 40% of the calls that we respond on each year are typically not what you would consider a mental health call. But, and these are the ones that the co-responders are responding to, not necessarily within the agency. Because there are some mental health calls where, the deputy can take care of those, and, maybe it's a clear-cut M1, or it's, a suicide threat, deputies will take care of those as well. But, we are responding to about 40% of calls that are not initially coded as a mental health call.
Okay. Can you also describe what co-responders do from the time they arrive on scene?
Yeah. When the co-responder arrives on scene, their goal is to obviously gather as much information as possible from either call notes, from deputies, from family, and they're going to work to de-escalate the situation. They're going to work with, doing the crisis intervention, the crisis work, doing any risk assessment that may need to be done. If it results in an M1, they're going to write that paperwork. They're going to transport if possible. And we also communicate to those back on scene of what is happening, what are the next steps, and what can be done in the future. If clients or individuals are left on scene, again, we leave as much information with those individuals as possible. Any resources, we provide business cards to them, and we encourage them, if this continues to escalate, if things get out of control, or if you need any assistance, here's the number for the co-responders. Please call. We're willing to help you walk you through this. We can give you the resources that you need. But again, if you are in a crisis, and if it's something that even our co-responders can handle over the phone versus a deputy, responding and going out in person, that's always an option as well. I mean, they're not going to do counseling, but we can, of course, work with de-escalation and do all that crisis work.
Okay, Sheriff Brown, do you think that co-responders have helped the Sheriff's Office in the long run since you started the program? And if so, how have things changed for the better?
I think they've helped immensely. I don't think that we would be as productive as we are without the co-responders. I think that it not only gets resources to the individual that's dealing with crisis, it frees up our law enforcement officers to get back to law enforcement and 911 calls quicker. And so it's just a force multiplier, and that's really what it comes down to. It's a tool on our belt that allows us to be more successful and provide a higher level of service to our community. And I don't see how our law enforcement agency would ever go away from this model. I think that this is something that is going to stay forever. And again, like I said, we're expanding this year, and it's only going to get bigger.
Yeah, we were really lucky too. You know, all the deputies bought into the program really quick. It didn't take a lot of persuasion. It was, you know, just getting them comfortable with being on scene with another person. But I mean, the feedback that we get from deputies is it's nice to hear that, you know, when we don't have a co-responder, that they miss them.
They do, and
You know?
they're constantly asking for them.
Yeah.
Their call sign on the radio are Mary units, and if we can get a Mary unit there, that's what our deputies want, is because it provides that higher level of service. And you know, I'm just ecstatic that they're here. I'm ecstatic that, you know, we had the vision through Chief Thompson to take this to council and to the county commissioners, and the partnership there. It's really it's a model policy, and you know, I would love to see it expand, you know, outside of our agency. I would love to see it expand inside, but I'd also love to see it continue to grow outside of our agency.
Okay, someone in the live chat is asking, are there co-responders that specialize in children and adolescents?
We have some that is what their experience is, that they have a background in that, you know, in previous careers. But again, all of our co-responders, they went through these classes, you know, in college. They're all master's level. They all do continuing education credits each year, which is a requirement through the state for licensure. And again, if they want ongoing training, that's something that the sheriff's office supports. So we try to provide any additional training that's going to be an asset to them and to their program.
All right, let's see, what else do we have here? How do you determine whether a person in a mental health crisis goes to jail or another type of facility? And how do you handle youth situations differently than adults?
So that's a great question. It has to do a lot with the victim. If there is criminal activity, if they meet the probable cause threshold to be taken into custody for a specific crime. And if it does go down that path, that's not where the mental health stops. We do have mental health teams inside of our detention facility that can continue that and work with our mental health personnel there. But our goal is to try to avoid that. And I think early intervention is very important when it comes to dealing with these mental health crisis and individuals in mental health crisis, and getting that co-responder on scene that has that expertise and that knowledge to assist in de-escalation, but then also take that next step in treatment.
Yeah, we are never, as you know, the co-responders are never going to get on call and jump into the deputy's job about whether crime, you know, somebody needs to be charged or not. We leave that up to the deputies. If there's some discretion, we work with the deputies as to, you know, what is a better outcome for this person. But sometimes they do have to go to jail, you know. Sometimes they have to be released on a summons. But we also here in Arapahoe County with the 18th Judicial Court System, they have some wonderful mental health programs. So we've had, you know, clients that have actually ended up in the system, but they make it really easy for us to communicate, provide those referrals, and we've had, you know, success with doing that as well and getting those individuals into the appropriate mental health treatment that they need. And as far as kids go, you know, again, we work with the families on scene. We try to, you know, pull in as many family members as possible that are going to be, you know, in the house, have them work with the kids. In the event a child needs to be transported, again, this is one of the benefits with us having those unmarked vehicles is, you know, all the co-responders, again, they're in plain clothes. The vehicle is unmarked. We do not handcuff when we put people in the back of our car. So if it's a child or a kiddo, we can walk them out to a vehicle. They're not going to be handcuffed. They're not thrown in a marked car, you know, and they're not getting all that extra attention, which, you know, could be more traumatizing to them.
Very well could be, and that's what we're trying to avoid at all costs. But, you know, going back to some of the criminal activity, you have to remember, too, that in the state of Colorado, some of the discretion is even taken away from deputies, especially when you're looking at domestic violence situations. So we could get a call of a verbal disturbance, and we arrive on scene that it has possibly some mental health caveat to it, and a mental health co-responder shows up on scene and is assisting somebody with mental health, but then we determine that it's a domestic violence situation. The state takes over at that point and, you know, requires law enforcement to to make an arrest when they're able to do so, and determining who that primary aggressor is. And if we do that, then it takes that discretion away from law enforcement officers, and action has to be taken. But again, those are situations that we try to avoid.
Okay. Someone asked, what do you do when someone requests a female deputy instead of a male? I was in a crisis and 3 male officers responded, and I asked multiple times for a female officer because I felt very uncomfortable, scared, and intimidated. I was told no by the male officers, which caused the situation to escalate very quickly and get out of hand. How can this be prevented in the future?
So we try to diversify our workforce when it comes to male and females. Sometimes we might not have a female on duty at that time, and that could be for a multitude of reasons. We're trying to make sure that we're addressing that, and having a good, diverse work population. But it's not always the case that there might be a male deputy available or a female deputy available, depending on what's going on or different calls that are occurring across the county.
How often do you evaluate your co-responder program and make changes to it?
The evaluation is ongoing. If every morning I come in, look at the calls for service, and if there's any changes that we can make, we're constantly trying to improve the program, make things better, for the community, make it safer for the community, for the deputies, for the co-responders. So it's ongoing. Always willing to hear suggestions and take those and see what we can do. It's, again, 2.5 years, and from starting, from scratch, I think we've done a pretty good job up until now, but, any suggestions, we're always open to it. We're open to any feedback. We get feedback, I get feedback from co-responders on a daily basis, and if anything can change to improve the program, that's what we're gonna do.
Okay, we only have a couple more questions. The next one is, how much does the average co-responder earn in compensation when compared to the officer they're working with, including overtime, bonuses, and benefits?
Starting salaries for our co-responders is in the low 70s. There was a lot of work done when we were putting together our budget package to get the salaries, and it is significantly higher than what we were finding for like community mental health centers or private facilities. So as far as deputies go, I think they're a little bit higher when they start out.
Depending on which
their
level they come in
experience,
at, and their experience, we could be anywhere from low 60s all the way up to the high 90s when they come to their top out date. But that happens within 7 years, so it kind of depends on where the deputy's at. And I think that we have a fairly good compensation program when it comes to benefits. Obviously we can try to always negotiate those and make sure that our employees are getting the top rated benefits at the least amount of price, because we all know that the cost of living here in Colorado, and especially in Arapahoe County in our area, is extremely high. So we try to make sure that we stay competitive through a compensation review process that we work in conjunction with the Arapahoe County HR department. So.
Okay. This person asks, well, first it started out with a comment. The officer's time is better spent elsewhere if the person in crisis is posing no threat. Do the officers leave the scene if that's the case and no laws are being broken? And do they leave the co-responder alone with the subject?
Yes, they can. Again, that's one of the reasons why we provide the training to the co-responders that we do. And yeah, if everything's good, there's no imminent threat, that's what we want. We want the deputies to be able to go back out on the street. We want the co-responders to stay, work with the families, file any reports that need to be, filed, contact hospitals, contact treatment facilities. We want them doing that and the deputies out doing their job. So yes, they will leave the co-responder.
Okay, and let's just end with this question. It's the last one. What can the community do to support the program?
That's a great question. I think, again, spreading the information that you're excited about it, and share it with your local government officials. You know, thank a city council member, thank the mayor, thank a county commissioner for allowing this to continue, and just share the good word. I think that that's the biggest thing. And if you have the inclination to reach out to a state legislator, please do that. I think that would be a huge benefit. So I know that Ginger said we were ending. I know that I read a couple questions over the shoulder of Ginger. One of them was, why are our patches so big?
Oh.
Those were actually designed by a deputy. And so that's the size that it fit into, and it was a contest actually, and a deputy or a couple deputies designed this patch, and it was selected. And then the next talk with Tyler, I think we're planning on something the beginning of August. The coroner, Dr. Kelly Lear, has agreed to come on and talk about the opioid crisis and fentanyl. She is one of the foremost experts when it comes to that, and has spoke at a couple different conferences addressing that specific issue, and we'll talk about the impacts that it has in our community and things that we're doing to combat it. So look for that information coming up in the next couple of weeks for something at the beginning of August. But again, congratulations to the Avalanche. I'd like to thank Julie and the co-responder team for all their amazing work, and our deputies out there every day that are doing the job. And one last thing, be safe out there. Happy 4th of July, everyone. Enjoy responsibly. Please remember that we're in a dry time, and fire danger is way up. And that's one of the things that a lot of people don't realize, is that the sheriff of counties is the fire warden in those areas that does not have a fire protection district, and we are still very dry. So be careful out there. Enjoy the holiday, enjoy time with friends and family, and be safe. We'll see you guys soon. Thanks.